Hey guys, this is Gabe. We are going to finish part 2 of our coronary artery bypass graft, or Cabg. Okay, so next we will be talking about medications after Cabg. First one up is aspirin. It's an antiplatelet drug used to protect bypass grafts and stent in the heart. It inhibits the enzyme COX-1, which produces prostaglandins and thromboxanes A2 that's necessary for blood clotting. It can be given orally or suppository. Some of the side effects are stomach pain or throwing up, and side effects that could affect physical therapy include signs of bleeding like throwing up, feeling weak, lightheaded, or weakness on one side of the body, trouble speaking or thinking, change in balance, dropping on one side of the face, or blurred eyesight, which to me sounds like symptoms of a stroke. Next on the list, we have our P2Y12 inhibitor or receptor blocker. P2Y12 or adenosine diphosphate ADP receptor is an essential part in the platelet activation process. It is often combined with aspirin for dual antiplatelet therapy. So P2Y12 is also an antiplatelet medication. The side effects involved with this are signs similar to low blood sugar, like dizziness, headache, feeling sleepy, feeling weak, shaking, a fast heartbeat, confusion, hunger, or sweating. Next up, we have our beta blockers. Beta blockers or beta adrenergic blocking agents are used to treat high blood pressure or hypertension. Beta blockers work by blocking the effects of the hormone epinephrine or adrenaline, which raises your heart rate. By blocking the effects, it forces your heart to beat more slowly and with less force, which also affects blood pressure as well. I don't think you could see my cursor, but on the big arrow, the little square guys are the beta blockers, and the little circles are the epinephrine. So it essentially fills in those spots so that it can't be filled, and it cannot raise your heart rate. So some of the side effects with these are diarrhea, upset stomach, vomiting. Side effects that affect physical therapy are shortness of breath, big weight gain, swelling in the arms or legs, change in balance, or muscle weakness and a lack of energy. Next, we have the ACE inhibitor. The angiotensin converting enzyme, or ACE inhibitor, helps to lower your blood pressure by relaxing your vessels. And how it does that is it prevents an enzyme in your body from producing called angiotensin, which narrows your blood vessel. And by narrowing your blood vessels, it can cause high blood pressure and forces your heart to work harder. So by prohibiting that, like it said, it relaxes your blood vessels and makes it work less hard. Some of the side effects that could include affect physical therapy are chest pains, high potassium levels that leads to confusion, shortness of breath, weakness, or heaviness in the legs. The last one on the list that we have here are statins. Statins are effective at lowering low-density lipoproteins, LDL, or also what we call bad cholesterols in your blood. With enough plaque buildup in the arteries, it could lead to atherosclerosis. So by taking these medications, it helps lower the case of any blockage in your arteries. While this medication does not affect physical therapy per se, some of the side effects are sleep problems, feeling sick, feeling unusually tired or physically weak, and in very rare cases, it's called rhabdomyolysis, which could lead to severe muscle damage, liver damage, and kidney failure. And like I said, since this is a very rare case, it's not very likely, like a couple cases in a million. And disregard this death rate picture. I only threw it on there because it was Had a little guy surfing a statin wave, so I thought that was kind of cool. Physical therapy after Cabg. So our goal with every patient that requires physical therapy is to get them up and moving. Specifically with patients after a Cabg operation, it is important to assess the adequacy of their cardiac blood flow during self-care activities and functional mobility. We also want to make sure we maximize their activity tolerance and monitor ways of their activity level, one of which is the Borg's rate of perceived effort, which is our RPE, and the second way is our blood pressure. With patients after Cabg, it's really important for them to know their sternal precautions. Why this is important is because we want the patient's incisions to heal and also their cartilage to heal. So with these precautions, we have do not reach arms up overhead, so no flexion past 90. Do not reach both arms out to the side, so no abduction past 90. Do not reach behind your back. Do not lift more than 10 pounds. So with your patients, you could tell them that a gallon of milk is about 8 pounds, so that gives them a good gauge on what 10 pounds feels like. Do not push with your arms, like pushing yourself up from a chair, and don't pull with your arms, like pulling open a heavy door. So I have a link down here if you'd like to click on it. It's actually a really interesting read. I did not include it in my paper because it conflicts with the sternal precautions that we are learning. They had a little catchy name called Keep Your Move in the Tube. And the idea with that is they did a study and they're saying by having restrictions such as lift no more than 10 pounds, it could reinforce the fear of activity and slows the process of patients' recovery and getting their functional ADLs. So with this research, what they did was they had a bunch of activities like pulling out a full dishwashing rack, which is 5 pounds, removing a gallon of milk from the fridge, which is 10 pounds, pushing a glass door that they exit the hospital, it's about 22 pounds. And what they found is when you sneeze or cough, you actually exert more force than any of those activities. So with a sneeze, you exert about 90 pounds of force, and with a cough, you exert about 60 pounds of force. So while they can't tell you that it's okay to lift 60 and 90 pounds, they're just basically proving a point that you can actually lift heavier and that these restrictions are inhibiting the patient. So with this move, keep your move in the tube, if you actually click on the link, it has diagrams of what you can and can't do. But the main idea is keeping your humerus close to your body while still using doing functional activities. So you can still push yourself up from a bed, but not in an extended arm position. And what they also say is you could do your basic ADLs up overhead as long as it's non-weight bearing. So it's actually a really cool read. We have been using it in some of the hospitals. It's not across the board yet, but we are definitely implementing this keep your move in the tube. So if anybody's interested, they could click on that link and learn a little bit more. For patients after Cabg, there is usually a reduction in their respiratory muscle strength, oxygenation, and pulmonary functions. Getting a patient started early on a cardiac rehabilitation program can significantly enhance recovery 1 month after Cabg. It is important while you're doing this to get more frequency to improve endurance for activity and therapy. With the cardiac rehab clinic that I worked at, they actually monitored them heavily. I took way more blood pressures than I ever want to in my life, especially sweaty patients. But yeah, they monitor their heart and vitals closely. They have a really narrow window of prescribed range, whether they're a phase 1, phase 2, or phase 3 patient. And based on their heart rate, we improve them in small increments. I believe for us, we used wattage, but I think in our lecture, they used METs. But the idea is still the same. It's just their work effort, and we also have them use their RPE just to also see how they're feeling aside from getting their blood pressure. It's really important, yeah, start them on light exercise programs, basically just to kind of get their heart pumping. And the progression is really slow. A lot of patients are actually complain about how they feel like they could do more, but we're basically following these small guidelines. I think it's about 10% each week or something like that. But yeah, getting them started on a rehabilitation program definitely helps with their recovery. So the last important component of physical therapy is our patient education. It's vital to let them know ways of preventing future occurrence from happening. Risk factor modifications include diet changes and lifestyle modifications. Teaching patients about self-pacing with activity will help them from overexerting themselves. Breathing techniques will also help patients to control their vitals and bring them back to baseline. And home exercise programs, or HEPs, will help patients be accountable for their rehabilitation process and get them back to their prior level of function. It's really important to have patients be their own advocate for their progress after physical therapy. So that is the end of my section. Thank you guys.